Hi, welcome to Pam's Pearls. I'm Dr. Pamela A. Rodriguez, aka Pam. This pearl is a Typhon tip on setting up defaults. So, what is Typhon? Well, it's your friend and it rhymes with hyphen. It's a program that we use for MSN and DNP nurse practitioner students in their clinical portion of the program. Typhon records all of your patient information that you enter into a database, and that can be shared with your clinical instructor and stores it into a very powerful database that we can manipulate the data into reports and check our progress through our clinical experience through the program. Now remember, it's just like any medical documentation. If it wasn't documented, it wasn't done. And here's a big tip from all of your instructors and any nurse practitioner student ever that has been in a clinical rotation that used some type of tracking program like Typhon. Don't get behind. You need to enter your patients into Typhon as soon as possible, maybe the evening that you had the clinical, but within a few days, and you will have a typhoon on your hands if you have to catch up on more than a day or two. Trust me. All right, so why do we set up defaults? Well, it's a time-saving feature, absolutely, and it streamlines our productivity. And in any graduate program and in life, we can always use more time and to use the time that we have more efficiently. So here's a blank case log sheet of the information we're entering into Typhon. Make sure you look it over. Even in the first semester, you want to enter any information that applies to the patient encounter experience, even if you didn't do something hands-on or don't understand the billing. It's very important that you add as much information as possible. Now, the arrows show the defaults that we're going to focus on to help build our patient information database. So here on the left, you can see the red arrow, and it's pointing to the student information. And these, you can see that it's semester, course, preceptor, clinical site. So while you're entering patients for a day or a week or whatever part of your rotation, this is likely not going to change. So we can put that in ahead of time. Now, I do want to note on the right here is the ICD-10 codes and the CPT billing codes. Make sure that you ask your preceptor what those would be specific to each patient, and try to get those as close as you can and get something in there. Okay, and there will be another presentation on this coming forth. Okay, so here's the bottom of that sheet, and note the procedure skills here on the left bottom corner. These are important to add in the patient data as you observe, assist, or actually perform a skill. And you will describe it in more detail in your note, but this section will record it specifically in the database. It's important that we put those in there. All right, so here at the bottom right, we see this big blank area for clinical notes. Wow, it's just blank. You can freeform it or you can set up defaults. Let's set up some defaults. But for now, what we'd like to do is I'd like for you to look at the tutorials. So you're going to view the video tutorial in Typhon, and it's at the bottom of the first column. And you're going to come down here on the main page under the help section, and it's going to be video tutorials. We're going to click on that. And then here you can see the student data entry video tutorial. It's the last one. It is 70 minutes, but it is 70 minutes that is well spent. But the nice thing is, so here on the left, you can see set up default choices. It comes in about 6 minutes and 50 seconds into the video. And as you can see, you click on any topic on the right and it'll go right to it in the video. So that's really nice. So let's click on default choices. All right, here's a list of the defaults that can be set up ahead of time. The required defaults are the student information. This puts in your clinical rotation information for the semester. This should not change very much unless you have more than one rotation in a semester, but if it changes, it's no problem. You can override it in each individual patient encounter, or you could go back into the defaults and change it there. Now to the right, there's a hyperlink here that says request addition. And this is if your clinical or preceptor site are not showing. You're going to click on that and go through the prompts for that. The powers behind the scenes are very good at getting these updated. So if there is an issue, just let your instructor know. Now, if you're in a rural or underserved area, right here at the second arrow, you can click that as a default. and you can unclick it as needed. Now this brings us down to the clinical note at the bottom, that big empty field. Now here you can see that they've added a template in there, and all you will do is load your template, and then you will have to click the button that says load default text to have it added to your note field. Then you can freeform and add any information in that you like. You can do that. You can add as little or as much part of a template as you like, or you can set up a template another way, and I'm going to share that with you. So programs are offering Office 365, as this one does with Word available. And you can see that I've opened a Word document. I'm in the Home tab here in the left-hand corner. I've circled it. And then I started with a blank document. Now here I could load up any template that I want, and I just want to put my cursor and click where I want to start typing. And then I'm going to go to the right-hand side here in the menu bar and click the dictate button, which has a microphone icon. I'm going to click that, and it allows me to do talk to text. And I said, hello, this is Pamela Rodriguez. I am taking lisinopril. And boom, there's my sentence exactly as I said it. Lisinopril is spelled correctly. I would just be very careful and note here that with medication names, you want to try to speak as phonetically as possible. And you really want to watch when you do a sound-alike medication that you're getting the right medication. So just make sure that it's accurate. And then I'm going to take my cursor and click wherever I want to record again. And I would do the little at the bottom here, there's a microphone. So I would click where I want to start typing now, click the microphone, record, and then pause it. And, you know, talk to text on your phone is not always what you think you said, but what the smartphones think you said. All right, so that's a nice little time-saving trick. Well, thank you for tuning in for this PamsPearl. Please tune in for more of Pam's Pearls, and it is a series of helpful hints and suggestions. And remember, as nurses, our motto is work smarter, not harder.